So I've been doing sex education for about 10 or 12 years at the Kinsey Institute. And the Kinsey Institute has this great tradition of receiving questions about sexual behavior and sexual health that goes back to Alfred Kinsey's time in the 1930s, 40s, and 50s. And then and now, some of the most common questions really revolve around, am I normal? And back in his day and during our time as well, many of these questions have to do with things like, is my penis size normal? Are my labia normal? This is a more recent question that we've been getting in the past 10 or so years. Or questions about whether or not somebody has an orgasm or how long they take to have sex, and then are those things normal? And, but ultimately people just want to know if they're okay, if their experiences are like other people's experiences. And so as part of sexual health, I think why this matters is because we all want some context for our sexual lives, and we want to understand sort of how our sexual behaviors play into our relationships, how they affect other people, how we can achieve happy, meaningful lives. Back in Alfred Kinsey's time, there simply wasn't much information publicly available about sex. We didn't have, for example, Cosmo out there with information about sex coming out every month. We didn't have a Men's Health or a Women's Health magazine that had information about sexual health. But now we actually do have many different ways of learning about sex. We have more widely available sexually explicit images. We have columns about sex. We have magazines and books about sex. But in some ways, this has resulted in so much information that it's difficult for people to tease apart what they can trust and what they can't, or what's sensational and what's going to impact them in meaningful ways. So certainly, in my experience, I get a lot of questions from people who are saying that, I've searched the internet looking for an answer to this question, and I've come up with so many different things. I don't know what to trust, or I don't know what to believe. And so I think part of this cultural conversation about sex needs to include some really trustworthy sources that we can highlight, and we can say, when people have questions about sex, these are the kinds of places to go to.